is Hannah Dunn, and today the topic of my presentation is how to obtain and interpret a set of vital signs. Supplies that you will need are a blood pressure cuff, a stethoscope, a pulse oximeter, and a thermometer. The reason I am doing this demonstration today is because as a nurse, I want all of my patients to feel empowered over their health. That being said, I think it's very important to know whether your vital signs are being taken correctly and how to interpret those numbers. To begin, you want to take your blood pressure cuff and place it snugly around your patient's arm. You want to ensure that your patient is sitting with their feet flat on the ground and that they have emptied their bladder, and also ask if they're having any pain. These are some simple factors that can go into fluctuations in a normal blood pressure reading. Next, you're going to take your stethoscope and put it on. You're going to place the bell in the patient's antecubital fossa, which can be found right in the crook of their elbow. And you want to make sure that the artery arrow is pointing directly at that line. Next, you're going to take the knob and you want to make sure it's turned all the way to the right until you meet slight resistance. I personally like to pump up the cuff into about 200 millimeters per mercury. Another good idea is to ask your patient what they typically run so that you know whether or not you're pumping it up high enough. So for this demonstration, I'm going to pump the cuff up to 200. Next, you're going to slowly, just a little bit, turn this knob. Now what I did there is you want to keep letting the arrow go down until you hear what is called the first Korsakoff sound. This sound is also known as the first beat that you hear. For my patient, the first number I heard was 118. That is his systolic blood pressure. The very last tick that you hear is his diastolic number. That was 68. So his blood pressure was 118 over 68. A perfect blood pressure is anything under 120 over 80. Anything above that is considered into the prehypertensive and hypertensive stages. Next, I'll place the pulse oximeter on my patient's finger. The pulse ox will also give you a pulse reading. And it's got, you'll put your hand up. The top number is his pulse, and the bottom number is his oxygen saturation. This machine uses an infrared sensor to pick up the oxygen saturation on the red blood cells. In this case, you want your oxygen level to be, if you're a young, healthy person, anywhere between 95 and 100. Other things, if you're a smoker, if you have COPD, anything like that, we like to see it between 90 and 100. His pulse is 77 right now. A perfect pulse is anywhere from 60 to 100, depending on a couple different factors. If you've just sat down, if you were walking around before you had your vital signs taken. I'm also going to demonstrate how to get a pulse manually. You want to take your patient's wrist, and on the thumb side is the radial artery. So you're going to follow the thumb down to right here in this position. And you'll feel the heartbeat. You need to watch with the second hand and I'm going to wait until it gets to a number, and I will count the pulse for 10 seconds. Okay, so I got 11 beats, so I'm going to multiply that by 6 to get my beats per minute. So 66. Last but not least is taking the temperature. This is a temporal thermometer. You may also have oral, otic, rectal, which is actually the most accurate, but it's not typically seen because it's so invasive. And also axillary, which can be done right under the armpit. So all I'm going to do is press my button to turn it on, and you're going to wait for the beep. It'll be blank, and I'm going to move this from the forehead to the temple and wait for the beep. "99 degrees. We like to see your temperature anywhere from 97 to about 99.9, depending if you've been sick. A fever would be anything over 101 we don't like to see. So those are the steps of getting your vital signs taken. I hope that you have learned something and have been able to see how this is done, and how if you're at the doctor's office or maybe you're going into the medical field, it's important to know these things, not only for your health, but also for others that you might be caring for in the future or anything like that. I want to thank you all for watching, and this is my audience as well, the rest of them. Okay, thank you.